Finance Committee has just released their coverage options, which weighed into a lot of these issues. And I know that Dr. Burgess, of course, is interested in sort of driving the House toward catching up to the Senate, I think, as is necessary with respect to defining the reform landscape. And when we talk about what our organization, America's Health Insurance Plans, has offered, we, of course, start by looking at these sort of as a package or companion solutions, if you will. And as Devin indicated, we talk about a mandate. We couple that with insurance market reforms and subsidies to ensure that those low-income individuals can afford the type of coverage that we'd like them to have. And when we look back, I think, at the evolution of AHIP and our approach toward a system where we're trying to get everyone in, it's helpful to sort of do a little tour as to where we've come as an association and to talk about a town meeting style listening forum, which of course is very familiar to members of Congress, that our CEO and President Karen Ignani did last year when she traveled to about 12 cities across the U.S., including Providence and Little Rock, Albuquerque, and just about everywhere in between. And what Karen heard was sort of a resounding chorus of folks who were interested in insurance market reforms, lowering the cost of insurance coverage, and making our system more affordable, which I know is a goal that Devin shares as well. And we looked as an association at the data to think about exactly what that would mean to sort of re-engineer a health system to that which we could all be proud of, rather than something that a lot of folks have suggested now is broken in many ways. And when we did that, we were driven by the data first. So as Devin indicated, there are a number of states, about 7 or 8, that have enacted insurance market reforms in the absence of a mandate. And truth be told, we've seen what's happened. The cost of coverage has risen very high, and it's pushed people out of the system. Some of those states, New Jersey, for example, the most recent state to enact guarantee issue and a community rating, since that time they've seen their individual insurance market reduced by about half. And when we look at this, we understand that the impact for young individuals, as Dr. Burgess indicated, is very profound. And indeed, in the census data that was alluded to, we know that the fastest growing age cohort in which the incidence of uninsurance is increasing is among those 18 to 35-year-olds. So whatever we do, we want to get those folks in to help balance the risk. And we want to make sure that they're not shocked by the impact of premiums if you move too far toward community rating, and in essence they're subsidizing the cost of those with coverage, or excuse me, with those older individuals. So I think it's important again to look at this in the universe of what we're saying, and that is, in order to get everyone in the system, our board came to the resolution that the only way we could do that is to couple the insurance market reforms with a mandate and with subsidies to ensure that coverage was affordable to those low-income populations that make up the majority of the uninsured. And there certainly are a lot of issues in addition to affordability related, as Dr. Burgess suggested, to the whole issue of benefit creep. This is why we've suggested that there should be an essential benefits package. Essential is a purposeful word because many folks, if you suggest a basic or a minimum benefit package, the automatic response is you're trying to encourage people to purchase the lowest common denominator. And the word essential, we believe, sort of reorients the system back toward value, where we think we should be, and essential sort of implying, underscoring that these benefits, including in this package, should be evidence-based, which, as was alluded to, we know that there are a lot of mandates individually at the state level now that may be very worthwhile for a lot of people. The question as to whether they should be included in an insurance package is another issue, and whether they provide solid evidence in terms of what they're producing for that individual. A couple other issues that I would touch on quickly. We certainly do have a lot of technical challenges that I think we have to wade through, as well as governance issues that was alluded to, with respect to the enforceability, with respect to how you're going to track people, how this would be recorded. And those are things that I think technically we have to have a very robust discussion about to make sure that we're careful in the way that we devise those. What we do know, however, from the Massachusetts experience, we've seen that in a very short time, they've been able to get the lion's share of the uninsured into their system. And we know, for instance, that there have been positive dividends on the employer side, because employer coverage, contrary to what was predicted, is actually up. And we know that in terms of human behavior, people are going to pursue coverage from the easiest source possible. And in this case, a lot of people are taking up employer coverage that they may not have been taking up before, so that's a positive result. I also want to touch on the issue of crowd out, because I think this is very important. Whatever we do, I think there's a sort of consensus in Washington that we want to build on the existing system. We recognize that the U.S. Chamber and other employers throughout the country have long been providing this terrific benefit that's very valuable to people on a voluntary basis. So as a first principle, I think everyone agrees that we want to do that. And in fact, I think that sort of would cause us to question whether this is the time for any sort of employer mandate or pay-or-play system. And I'll just sort of raise that question. I know Katie will have a lot to say about it. I'd like to conclude by thanking Dr. Burgess for the opportunity to briefly mention the meeting that was alluded to at the White House yesterday. And I think that with respect to what we're doing, just as we've come forward with our set of solutions with respect to trying to get everyone into the system, again, coupling the mandate with insurance market reforms and subsidies, we've also said that we have a responsibility as a stakeholder to come forward with ways, as Dr. Burgess said, that we can promote a more efficient health system in the delivery of care, and also that we could lower our own cost. Within our board of directors, there is a strongly held and profound belief that if anybody knows how we can lower our cost, it's not the U.S. Congress, it's not one of the other stakeholder groups, it's the plans themselves. This is why we've been having a very robust conversation around the idea of administrative simplification, as Dr. Burgess again suggested, some of the burden that's placed on the providers, how we can streamline that, make it more consistent, make it more predictable. Two things I'd like to mention. One, which is underway in Ohio and in New Jersey. We're working on a uniform payment portal system that essentially, without getting into the technical issues and sort of way into the weeds on the operations side and the claims processing side of healthcare, what we're really trying to do is develop a uniform system that I would analogize to MasterCard and Visa for the banks, so that just as each of the banks can issue their own card under the Master or Visa emblem, each of the health plans could have their own systems, but for purposes of Dr. Burgess and his colleagues at the AMA and others, they would feed their claims through one unified system that would give them up-to-date information on benefits eligibility, claims process, and tracking. Because of the way that our system developed, just as we've had to sort of rationalize information technology in other sectors, we're doing this again on a pilot basis in New Jersey and Ohio, because there are just numerous and infinite technical details to wade through. So that's one thing that sort of we're operationalizing and testing now. One other thing that I mentioned real quickly, we've had a CEO level group that's been looking at administrative simplification at our board for some months. And one of the reasons why we had this meeting yesterday is because we've had very positive dialogue with our friends at the AMA, the American Hospital Association and some of the other stakeholders about just some of these claims and administrative issues that drive them crazy, in an effort that we can promote some consistency and rationalize the systems across the United States, because as everyone knows, I think that that's a goal likewise that we all share for health reform. So thank you again, Dr. Burgess. Thank you, Scott.
All right, welcome to the Healthcare Insurance Hangout. I'm Joey Giangola with Giangola Insurance, and today I'm going to be pulling back the curtain, delivering a mini manifesto, if you will, telling you why your health needs to come first and why these Hangouts could be successful and what they could do if we are successful with this. We're going to take a look at how we can fix the healthcare system this way. Today I'm flying solo. There's nobody else joining me. Partly by design, partly by accident. Well, mostly by accident, but you got to take opportunity and grab it by something, whatever they say about opportunity. So I thought, let's go ahead and just really dive deep into the fact of why we're doing these Hangouts and what you're supposed to be getting out of them. I try and sum them up at the beginning of every episode and kind of give you just a really brief, 1-2 lines of why this is important and what benefits you're going to receive from the information that we're providing. But dedicating a full hangout to it, I think is only going to help you understand and get the most out of each episode moving forward. So for those of you who are unfamiliar with the Healthcare Insurance Hangout, this is what we do. We try and put the health back in your health insurance by finally connecting all the dots to the industries affected by or related to it. So again, we're moving far beyond a policy here, and we're really just going into some unexplored territory. So what we're going to do today, and the reason that I felt this was so important is, we touch upon different industries. It's called the Healthcare Insurance Hangout for a reason, because we focus on the 3 avenues, the 3 areas that I feel are most affected by your health insurance. That is the health industry, the fitness, nutrition, wellness, all that fun stuff. In addition to your medical treatment, that's going to see your doctor, a hospital, any type of testing, all that fun stuff. And then ultimately your insurance too, how to maximize those different areas as well. So you put those 3 things together, and that's what really makes up, in my mind, the healthcare system. If you want to actually label it a little more specifically, I've broken it down into 3 industries that generally one feeds off the other and kind of creates this whole system. And we're dealing with a country that's struggling with its healthcare system that is with excessive spending. But the different industries that are, in my mind, that come together to make this system is first the food industry. You don't hear it talked about that often, but this is the first, and I would maybe say most important, industry that gets greatly overlooked in its role, its responsibility in all this. And then, of course, it is the medical industry is second, which is, again, like we said, doctors, hospitals, and things like that. And then, of course, you have the insurance industry that make up this healthcare system. So let's first start by talking about the difference between health care and health insurance. A lot of the times those two become one and the same and people put them together. They're very, very different things. Like I said, health care or the medical industry, that's the actual treatment. That's you actually going to the doctor, that's you actually getting a prescription, that's you actually having a procedure done. That is health care in action. Whatever type of medical treatment or service you are receiving, that is your health care. That is not health insurance. Health insurance is simply a means for you to finance that treatment. Health insurance mainly exists due to the fact that it is required of you to be able to finance these procedures. If there was no need for financing, if they didn't cost what they cost, then there would be no health insurance. I can promise you that. And that's something I think is important to understand, is that people sometimes want to say, well, we should just have free health care. We should just have we shouldn't need health insurance. Well, health insurance is like your student loan. It's like your mortgage. It's like Wells Fargo or Sallie Mae. They're just offering you a way to defer that cost. You defer that cost by paying monthly premiums each month. So when you run into a scenario, you've already kind of paid in. You've already paid your dues, and you have that coverage available to you. That's really all it is. It's not more complicated than that. And when people try and make it more complicated, that's when I think things become a little bit out of control. So let's kind of talk about real quick the fact that the medical costs themselves, is obviously part of the big reason why things are out of control. I was just looking, kind of doing some digging before we started here today, and I ran across an article that kind of went into the cost of developing a prescription medication and how much it actually costs for just one drug, for just one medication to be developed. It's actually very crazy. The average drug developed by a major pharmaceutical company costs at least 4 billion. That's a B, billion, and it can be as much as 11 billion. And this was courtesy of Matthew Herper of Forbes. He went on to state that AstraZeneca has spent 12 billion in research money for every new drug approved, and that's as much as the top-selling medicine ever generated in annual sales. So that's, I mean, anybody that's in business, that's not a fantastic business model, if you will. And to top that all off, outside of the prescription costs, America itself had spent in 2011 $2.6 trillion on healthcare. A third of that spending, a full 750 billion, did not make anyone healthier. It was just excessive, you could say waste, whatever, mismanaged care, but $750 billion did absolutely nothing. And that's courtesy of Sarah Cliff of the Washington Post. So, I mean, those are just some kind of a brief snapshot of the costs that we're dealing with when talking about health insurance and the healthcare system. And it's impossible. I've said it before. It's an impossible. There's so much talk about the excessive costs and the affordability of health insurance and why people can't afford it. And you cannot have affordable health insurance unless you have something, do something to address the affordability of the services in which you're trying to insure. It's just lunacy to think that it's going to happen any other way. I don't know how else to put it to you. And again, now I think we're somewhere around 3 trillion per year. Now I think after, since 2011, I think we've hit, we've gone ahead and hit the 3 trillion mark per year as far as how much we spend on healthcare. And this is where it's obviously we're spending a ton of money on it. So where's this going to come from? You can't just magically wave a wand and just say, here, everyone have affordable health insurance. It's not going to work that way. There's obviously a lot to be said about these costs and how they, affect the system in general. For first off, that 3 trillion, that's growing at 4% each year. And it's just, there's nothing to slow it down right now. You go ahead and put on top of that the healthcare payment system. It rewards expensive procedures and specialties. Not primary care physicians and preventative care. I mean, preventative care is, getting your blood checked once a year maybe and having your doctor check your reflexes. I mean, there's very little in regards to preventative care. And then, I mean, moving into that, I mean, on top of that, and coming back to that industry that I feel is, the catalyst of it all, the food industry. I mean, it's focused on speed and low cost, not health. I did a hangout a couple weeks ago with Adrian Ramo, a nutritionist, who, we were talking about, the fact that, the way that they deliver their products, the way that they, present them, I mean, it's doing the exact opposite in which they're intended to do. I use the analogy of it would be kind of like a firefighter coming to your house and setting it on fire. That's kind of what they're delivering to you. That's kind of the service they're providing for you. Now, some people want to debate this and they want to go back and forth on the validity of it, the science behind it, and that, this, that, and the other. And they want to say, well, if I want to eat a Twinkie, I should be able to eat a Twinkie. And I think that's fine, but I think we've reached a point where we almost can't afford to, looking at these costs, looking at the cost of prescription medications, and the fact that these conditions are leading to such a high rate of cost of service. It's just we have to be more aware of these things, and it all trickles down. It all feeds off of each other and creates this kind of vicious cycle that won't stop until we kind of start connecting these dots, and that's what we're trying to do, and that's why we're doing this. I've said this before periodically throughout the Hangouts. If you haven't, if this is the first time you're here, all this stuff, all this information, this is all taken from personal experience. I try and bring on the best experts that I can find to discuss these topics and further in depth. But this is something that beyond just my career in insurance that I have a personal interest in. From personal experience, I can even show you. We can just pull this up right now. I mean, that's where I was. I've showed this before. I mean, that's me 2005-ish, my junior year of college. That's me at about 260 pounds. So that's pretty heavy stuff. And I was what 20, 21 years old, and I was having expensive medical tests done because my body was not appreciating the way that I was treating it. And enough was enough, and eventually, slowly over time, I kind of put each piece together and started to do things a little bit differently, and made changes that I feel were for the best. And so this is not to say that I'm just kind of pulling this out of the air because I think it's a good idea. It's something that I've kind of lived and breathed myself and have experience with it. So anything that I've told you, it's something that I've either done myself or have experienced firsthand. But kind of going back to that obesity, the former fat guy that I was, in 2008, medical costs associated with obesity were estimated at $147 billion. The medical costs for people who are obese were around $1,429 higher than those of normal weight. More than 1/3 of U.S. adults right now, 35.7%, are obese. And obviously, the conditions. I mean, this is no surprise. We're not breaking any news here, but the conditions related to obesity: heart disease, stroke, type 2 diabetes, certain types of cancer, and these are some of the leading causes of preventable death. So these are the things that affects it. This is what happens, if you don't listen up and you don't kind of just try and take a look at these things. And I think that, I guess I don't know. And if anybody wants to, provide me a little insight on where you're at as far as some of the things you're struggling with, some of the issues that are important to you, and what you're not particularly thrilled with, I'd love to hear that. And again, it's all just feeds off of one another. It all goes back and forth, and one continues to make the other, continue to cost more, be less efficient, so on and so forth. I think that the biggest thing to keep in mind, that we don't want to take a hard look at what we're doing and if we can do it better, and we just kind of want to go on, keep the status quo, and continue to do things the way that we've always done because, well, you hear from it, well, we raised you that way and you turned out just fine. Well, at some point, that's not going to be an acceptable answer anymore, and that's what we're trying to do here. Is to give you that behind the scenes look, that information that's going to help you understand these different things, and kind of talking about bridging that gap of the food industry and the medical industry, and the fact that people want to associate the medical industry as being leaders in nutrition. That's not necessarily the case, and I got an article here that ran in the New York Times back in 2010, but it was very telling of the state of the knowledge of doctors and how much nutrition knowledge they actually have. This was from Dr. Pauline W. Chen, who is a registered doctor, and admitted that once she got admitted to medical school, she was inundated with questions from her friends and family about, should I do this? Should I eat that? What about this? What about that? And I mean, she just got accepted to medical school, and wasn't even a doctor yet, and she found that to be very surprising. And after she had became a doctor, it was still the same thing. People were still asking her what type of essentially lifestyle she should lead as far as nutrition goes. What type of health choices they should make beyond just medicine. Now, there is very little, and I found this very surprising, very little education, information requirement for these doctors in the regards of nutrition. They kind of fall back to the dietitians, the nutritionists, if you will, and they really don't have anything to do with it themselves. And I want to read an excerpt here from the article. And she said that years later, as a newly minted doctor on the wards seeing real patients, I found myself in the same position. I was still getting a lot of questions about food and diet, and I was still hesitating when answering. I wasn't sure I knew that much more after medical school than I did before. One day I mentioned this uncomfortable situation to another young doctor. Just consult a dietitian if you have a problem, is what this other doctor said. She said, after listening to my confession, they'll take care of it. She paused for a moment, looked suspiciously around the nursing station, then leaned over and whispered, I know we're supposed to know about nutrition and diet, but none of us really does. And that's crazy. I mean, we look to these people, and this was back in 2010. I don't know. I don't have any more updated information if anything has changed in the last couple of years. From my own personal observations of people in the medical industry, I would say that it hasn't. I mean, some more than others are going to be informed. I mean, I feel that I could, tell you just as much about some proper nutrition than, a nurse or a doctor. And I'm an insurance agent, and I don't know why that somebody that close connected to that isn't required to have at least some sort of functioning knowledge on this stuff. I mean, yeah, I mean, you could say that they do, but obviously if you've got somebody writing an article like this, I mean, that's pretty telling, and also part of the problem, because people want to listen to their doctors. They trust their doctors more than anything. Well, not more than anything, but quite a bit. And that is, when you have that kind of trust, they, whether or not it is the doctor's responsibility or not, but right now, I don't look at them as anything more than a fancy human mechanic. I mean, there's somebody that I'm going to go see after something has happened, and they can take care of me. There is very little very little focus on, helping you put together some sort of wellness preventative program. Is that up to somebody else? I don't know. I don't know whose responsibility it is, but that's what we're doing here. We're asking these questions. We're finding the people to answer them, and we're trying to help you. As you can see, as you connect all the dots, as we start to connect all these dots here to this problem, this issue, you see that most of it is actually completely in our control. If all we have to do is trade a bag of Doritos for a bag of pecans, and maybe ask our doctor how necessary a certain test is, or if there possibly is another place that does it more affordably. I mean, shouldn't we? I mean, don't we have that responsibility to ourselves to just kind of the healthcare system in general? But again, that's what the Healthcare Insurance Hangout is all about. We're providing you, like I said, this information to empower ourselves to solve our own problems and not really wait for an industry or government to do it for us, because it's very possible, sadly, it may be true or not, but it might be too late if we do. And this isn't meant to preach, dictate, or look down upon your current situation, but it's rather to enlighten, inspire, and really help you and everybody else move forward. We all want to live a better life, even if I'm wrong, even if all these other people that are preaching the benefits of healthy living, exercise, fitness, whole foods, and all that fun stuff, even if we happen to all be wrong, I can guarantee. I guess if I happen to be wrong in the sense that I'm saying that this is going to ultimately improve, your health insurance, your medical outcome outlook, if you will, your forecast. What I'm not wrong about, I can guarantee you this: at the end of the day, if you do focus and take care of yourself on the front of fitness, of exercise, of nutrition, and you start to make that a priority, I promise you the quality of your life will drastically improve. You will almost feel like a superhuman as far as what you're able to do, and just the way that you go about your day. You will not need or rely on these other stimulants, if you will, to get you through the day. You will feel 10 times much better. You'll be happier. You will be sleeping better. You will be waiting for your kids to catch up with you, as far as when you're playing with them. Generally they're the ones that are running you around and wearing you out. I mean, those are the things that are important, and those are the things that you want to focus on. I mean, at the end of the day, I've asked this question. I've said it multiple times before. At the end of the day, what's ultimately more important than your health, your family's health, and the health of the people around you? I mean, it's not your job. It's not it's not what kind of interior decorating you're doing. It's not anything. It's not whatever movie you're going to watch later that night. I mean, honestly, what is more important than that? And if focusing on that and making that be a priority and be important, involves making a few more conscious decisions related to food, nutrition, your medical treatment, then why wouldn't you? So you can see that the numbers, they're not adding up, and we can keep letting them go that way until we really can't count them anymore, or we can realize that this big problem, well, it's maybe has a few surprisingly simple solutions, but it's going to take us working together and saying, well, guess what? We can do a little better here, and if we can do a little better, why wouldn't we want to do a little better, as opposed to continuing to kind of drown in our mediocrity of unsuccessfulness related to these different things. It's frustrating when you kind of look at it this way, and that's what we're looking to do. So again, like I said, this was just a kind of a quick look, an opportunity to talk to you kind of one-on-one as far as what we're doing here, why we're doing it, and why I think it's important, and why I think if you give it a chance, it will, you know, potentially change your life. If I can, or if we can as a company, not only protect your financial well-being as it relates to, you know, medical services and treatment, but in addition, protect your wellness, your health in general, I mean, that's impacting you on two of the most important areas of your life. And being able to do that, I think, is pretty powerful. And, you know, that's our goal here. So we might not always get it right. We might not always be perfect, but this is a work in progress. It's a, you know, it's a big experiment. And if at any point in time you have some feedback, you want to know what's going on, and you have a suggestion, you know, please let me know what's of interest to you, what you're struggling with to do better as far as your health, your fitness. What do you not understand? What needs cleared up for you? And we'll try and find somebody. Again, a lot of the people that are supposed to talk about this and be experts, well, they're not exactly all that forthcoming and open or accustomed to delivering their message in that way. And that's also part of the reason that, you know, a day like today, where it's, you know, it's just me and you, these people, they're not as willing to discuss this. So we're kind of also changing the culture of the way people generally get and receive information. You know, you get your information from your doctor, you call them up, you schedule an appointment, you got to pay him $100 to get in his little room for 10 minutes, and that's how you get his information. We don't do things that way anymore. You can watch videos like this. You can, you know, search the internet for just about anything that you need, and they're slowly coming around to this. And getting these people on board and getting them to share their expertise and information in a way that compels you to take action is the challenge. So if you are out there and you think you are somebody who has that information and, you know, would like to become, you know, a guest on the show, want to hang out, you know, to talk about the benefits of health, of insurance, of medical treatment, why, welcome. Email me, joey@jingolainsurance.com. Again, that's joey@jingolainsurance.com, and we will go ahead and set something up and you know, get this going. So, but like I said, I wanted to take, you know, just a little bit of your time and give you a behind the scenes look of what it is that we're doing, why we're doing it, and why I think it's important for you. So don't let this be overwhelming. Don't let it be whatever you want. Just sit back, enjoy the information, do the best with what you can, with when you have to, and we will continue to bring this information to you, and hopefully, you know, at the end of the day, we'll make a difference in some regard. So hey, thanks for stopping by today. I'm Joey Jingola with Jingola Insurance Agency. Take it easy, everyone.